Hi, this is Dr. Ryan Bell with Yada Yada. Let's talk about speech delays. So speech delays are a common issue in kids. It's something we're looking at every well child check. We're wanting to know, even from the start, if your child's making some noises, if they're vocalizing, and then we're watching that progression pretty quick. Important milestones for me would be a child usually around 9 months old should start saying some mama, dada kind of sounds, some consonant noises. Usually by a year, using those specifically as words, kind of identifying mama, dada, using them correctly. Some progression there to the 18-month mark, to where you expect to see about 5 to 10 single words. Some kids at this point are way ahead of schedule. It seems like especially our firstborn children, and it seems like our girls tend to be ahead of schedule for a lot of those visits. And some of them talking in full sentences by 18 months and having adult conversations. But really the typical thing and what we expect is more like 5 to 10 single words. Progression continues to that 2-year mark, where we expect it to be more like 40 to 50 words. And we like to see at that point that your child's starting to put words together, little 2- and 3-word phrases. Being more clear, we still expect for a lot of what they say to just be their own unique language. But a stranger should be able to understand about half of what your child's saying at 2 years old. By 3 years old, more sentences, vocabulary growing week to week. Strangers should be able to understand about 3/4 of what your child's saying at that 3-year mark. And then by 4 years, we expect to be having conversations with those kids, full sentences. Strangers should be able to understand most of what they're saying. So along the way, important things for you as parents: be sure you're reading with your kids, even starting in those younger ages, 4 months, 6 months, 9 months. Make it a regular thing. We want to be reading 10 to 15 minutes a day early on, at least 20 minutes a day once they hit about that year mark. If you're concerned about your child's language, talk it over with your pediatrician. There are a lot of resources available for help with speech delays. Government programs are run for most kids up to the age of 3. Most universities have programs to help with kids and their speech. There's private resources in most communities to help with speech delays or speech issues. And if your child gets into the public school system and is having issues, they can pull your child out of kindergarten and 1st grade and work with them on their speech. I don't stress too much about some of the sounds and the pronunciation issues. A lot of kids struggle with their R's or with certain letter sounds, but as long as overall you can understand what they're saying, their vocabulary is growing appropriately, they're getting easier to understand as time goes on, I tend to not stress too much about those kiddos. There's a strong family history of speech delays. We're going to be a little quicker to refer your child to speech therapy. And if there's any concerns along the way of hearing issues with your child, we're quick to say, let's get in and do a hearing evaluation and start to work with a speech specialist. So those are resources available. Good luck, and I hope your child continues to talk and to be appropriate with their language development. Thanks.